and get an inside look at the latest in healthcare, medical technology, and treatments. This is Rex on Call.
My experience, women are amazing copers. They tend to deal with these problems silently for many years before they actually say, look, enough is enough.
We are amazing copers. Welcome to Rex on Call live on WRAL. I'm Kim Dean Holderness for Rex Healthcare. Today we are talking all about those topics our mothers warned us about. This episode of Rex on Call is devoted to women's health and giving you the answers on what to expect as we age. We will cover everything from gynecological issues, women's cancers, to menopause. If you're watching us now live on WRAL and you have questions concerning women's health, call us. Your questions may be answered here live on our program by our experts. The experts answering your questions are Dr. Ann Collins, an OBGYN with Center OBGYN, and Dr. Kenneth Kim, Assistant Professor at UNC Gynecologic Oncology. To call us here at Rex on Call, just dial that number on your screen in Wake County, 919-744-3876. Outside of Wake County, call us toll free, 877-277-6252. If you're watching us as we're streaming live on WRAL.com, email us your questions to rexoncall@rexhealth.com. You can even find us on Twitter. You can send us a message at RexHealthcare, #RexOnCall. Now, listen up, ladies. It's time to have a real conversation about what really happens to our bodies as we get older. Did you know about half of us will suffer from a pelvic floor disorder after the age of 50? We don't often talk about how we have to race to the bathroom or avoid certain exercises or other daily activities for fear of an embarrassing accident. Let's take any embarrassment out of it and get some straight talk about real solutions. Urinary or bowel incontinence or pelvic floor prolapse, I can talk today, may happen, but the new UNC Pelvic Health Center at Rex means you don't have to live with it.
Chances are these women have stories that sound a lot like your own or that of someone you love.
I am the mother of 4 children, the second of which had a rather large head.
I think as children, as a lady, that we're taught not to talk about our bodily functions. It's taboo. It's not something that you sit around the break room and laugh and talk about. It's all kept secret.
So for quite some time, I would go to my gynecologist and complain about leakage, incontinence, and had gone through various and sundry attempted fixes for the leakage issues, including biofeedback, being fitted for a pessary, Kegels, what have you.
You plan your life around the bathroom, actually. You can't go to the movie because that's 2 hours unless you go right before, and if you can make it till the end of the movie.
For Catherine Urich and Ann Wicker, after decades of living with incontinence and other pelvic health issues, they found Dr. Catherine Matthews in the new UNC Pelvic Health Center at Rex.
I wanted to create an environment where women could get comprehensive pelvic floor services all in one place. It takes a lot of courage for a woman to actually seek help for these problems to begin with. And so you can imagine if we send them on a wild goose chase, seeing different experts in the various pelvic floor problems that can exist, it can be very intimidating for somebody.
The new UNC Pelvic Health Center at Rex diagnoses and treats the issues so many women have been living with for so long: urinary leakage, accidental bowel leakage, and pelvic organ prolapse.
As a lot of pelvic floor problems happen in concert with other things, we thought if we could put colorectal surgery, urology, urogynecology in the same place and offer the diagnostic testing in that place, that women would get better service. In my experience, women are amazing copers. They tend to deal with these problems silently for many years before they actually say, look, enough is enough.
For Ann Wicker, that meant surgery to repair her prolapse. Life for her now is completely different.
If you're in an exercise class and they say jumping jacks, you don't have to say, just a minute.
And for Catherine Urich, a bladder sling improved her quality of life.
You don't have to worry about picking up that gallon of milk at the grocery store or picking up your grandchildren and worrying, are you going to have an accident?
And thank you to those wonderful women for sharing those stories. And we are joined by Drs. Kenneth Kim and Ann Collins, and we already have the phones busy and a lot of questions have already come in, so let's get right to it. There was a question that came in: how long do hot flashes of menopause last? And after menopause, does libido ever return to normal?
That's a great question. Generally, hot flashes are going to last about 6 months to 2 years, but they can go on for several decades.
Oh.
They tend to get better, but in a rare instance, you can still see them. Libido issues, in addition to your hormones, your estrogen levels dropping, so do your androgens, which affect some of your libido issues. And it may not be the same as it was when you were younger, but there are some other strategies that your doctor can discuss with you and other potential aspects to hormone replacement therapy, such as testosterone or androgens, that potentially could help.
Okay, and Dr. Kim, let's talk women's cancers as we age. What are we looking at? What are we more susceptible to?
Well, you're around menopause and definitely after menopause, since the ovaries are shutting down their production of hormones. Being that this is America, there's obviously an obesity problem, so there's increasing risk, especially in this country, for endometrial cancer. Unfortunately, though, there's not a good way to screen for endometrial cancer. So luckily, there's an early sign, an early symptom. If you have vaginal bleeding, you should definitely seek out medical health sooner rather than later, so it's caught at an early stage, which the majority of endometrial cancers are caught.
Okay, great. The next question, and either one of you can take this. I have Recticel and need surgery, and the question is mesh safe? Are there other options?
There are several options in treating a Recticel, and surgery is certainly one of those, and the most definitive option. There are different ways to do Recticel repairs, and some do involve the mesh. I would speak to your physician, make sure your physician feels comfortable with the mesh, but certainly it can be very, very safe.
And what is Recticel? I'm sorry.
A Recticel is where there is relaxation between the vaginal wall and the wall of the rectum, and that area has either thinned out or become weakened and can cause problems with issues going to the bathroom and sometimes with pain issues.
Okay, and then we're here to talk about that today. So the next question, yes, the next question has been through menopause, but the moodiness, breast tenderness, and cramps are still continuing. The question is, does this ever stop? This seems so unfair, but the question, does that ever stop?
It should stop. Menopause is technically defined as no period for one entire year. However, you may have enough hormones that you still have some of the moodiness and some of the breast tenderness and changes without necessarily having a menstrual period. If the symptoms exacerbate and continue longer than a year, however, you should be seen to make sure there are no other reasons for you to be having these symptoms that would need to be evaluated, because generally they should get better.
Okay, they should get better. Okay. Dr. Kim, talk to us about cancer screenings and the new guidelines that we should be aware of.
Yeah. Last year, as far as cervical cancer screening guidelines, they made some adjustments based on the most current data available. Now, whereas before, pap smears used to be an annual thing, now it's every 3 years, and you can even extend the interval in certain patients with co-testing. So there's the starting of the pap smears, and there's also the end of when you should stop having pap smears done, and that happens at around age 65. And all of the various organizations that make guidelines for cervical cancer screening tend to agree on that, or after a complete hysterectomy, uterus and cervix being taken out. Now, if they had a history of cervical dysplasia or cervical precancer, they may need screening for additional number of years depending on the circumstance and their treatment, things like that. But as far as cervical cancer screening, now every 3 years up to maybe every 5 years, stop at 65 or after you've had a complete hysterectomy.
Okay, I'm going to ask you a follow-up question on that after the break, and we are back to answer your questions in Wake County. 919-744-3876. Outside of Wake County, toll-free 877-277-6252. If you're watching us as we're streaming live on WRAL.com, email us your questions to rexoncall@rexhealth.com. Stay with us. Welcome back. This is Rex on Call live on WRAL. Today we're answering your questions on women's health and what really happens to our bodies as we age. If you have questions for our experts, give us a call. That number on your screen. Let's get right to it. This call from Oxford, North Carolina. Could you discuss nocturia? And first of all, you have to explain what that is, and then when there's no medical reason.
Nocturia is getting up in the middle of the night to have to go to the bathroom, and there's a large number of women who will have those symptoms for a variety of reasons. It may be because they drink a large portion of their water or caffeinated beverages or alcoholic beverages later in the evening, and certainly that's going to contribute to it. It may be that their sleep is just interrupted and then they wake up and feel like they have to void and have to go to the bathroom. I would discuss it with their physician. They could have some overactive bladder components as well that could potentially be amenable to medication therapy, or it could just be changing their habits.
Changing, drinking less at
Right.
night. This is from Kinley. This woman will be 48 in October. She had regular periods until July. She's just been spotting since then. Is that menopause?
It could be menopause.
And will you know this is menopause?
It is so, menopause is very variable, and it's almost like a personal experience for everyone who goes through it. Obviously, I have no experience going through menopause, but some women know that they're going through the change. They can feel hormones, they can feel hot flashes. Some women, they, kind of just stop having periods, and, it's less of a rough ride for them. It just is highly variable, but in her, it could very well be the beginning of menopause.
And it could take several years before she's fully there, right? This is
Absolutely.
a process.
The perimenopausal period can be anywhere from 45 to 55. An average age of menopause is 51, but some people that's going to be earlier and some people it's going to be later. And they're going to have some irregular symptoms potentially for several years. I would be concerned if she continues to have spotting, because there could be other reasons why she's having spotting. It could be an irregularity in her hormones as she gets closer to menopause, but it also could be something abnormal. And I think if she continues to have those symptoms, it would be best to see your gynecologist and let them evaluate it and just make sure there's nothing else going on that would be a problem.
Absolutely. Better safe than sorry. And this is from Carol. What can you take to help with sex drive besides hormones after a hysterectomy?
Well, I think it depends on what's going on, and there's so many things that go into libido and go into sex drive. And when you talk hysterectomy, we as medical professionals generally believe that's just removing the uterus. And if your ovaries were left behind, your hormone levels really should be fairly normal, and you shouldn't have a lot of changes associated with your hormones if they are intact. If they're not, then I think you have to look at multiple things. One thing is hormones. The other is counseling, and there's some very good counselors out there who work with women, because for women it is sometimes what's in our minds as well as what's in our bodies.
Absolutely. There's a lot going on here, isn't there? Okay, this is from Gwendolyn. If you've had a hysterectomy and you're on Pembrin, a hormone replacement drug, and it's for 15 years, is there a danger in taking that hormone replacement for that long?
I'm thinking she probably meant Primpro.
Okay.
Which is a medication. However, it may just be Premarin, because if she's had a hysterectomy, in general, you shouldn't need to be on a combination therapy. Estrogen only would be appropriate for you. Is there a danger? That's a very good question. I don't know that anyone has pinpointed you should only be on hormones for this period of time. We believe in the early menopause, as you are finishing that menopause, that your risk is lower. And if you don't have other health risk, it's lower. And some people will continue, women, on into their 60s on hormones, but you do start to develop some risk potentially of stroke, and then there's always a risk of blood clots. So I think it needs to be revisited at every visit with your gynecologist.
And Dr. Kim, I was going to ask you that follow-up question about stopping the pap smears at age 65. Is that because there's a decreased risk?
In most women who've had normal pap smears up until that point in their life, it is safe to stop pap smears at that point, because their risk of developing any sort of cervical abnormality at that point is very low.
Okay.
Even with new sexual partners or things like that.
Okay, good to know. Now, coming up, they are saving lives by day and rock stars at night. We'll tell you how you can get a glimpse of these real-life superheroes in concert. And we'll answer more of your questions. One of the numbers at the bottom of your screen. Call us now or email us your questions to rexoncall@rexhealth.com. Welcome back to Rex on Call live here on WRAL. Let's get right to your questions. Okay, when you have a hysterectomy, can you get cervical cancer? And do you have to get a pap smear?
So it depends on what kind of hysterectomy you've had. If it was a total hysterectomy where they removed the cervix and the uterus, and assuming that it was not done for cervical disease, cervical dysplasia, you may not need pap smears. However, the reasons for the hysterectomy, and depending on whether it was a complete versus partial, needs to be kind of reviewed. And if they follow with their OBGYN, they can sort that out. And
So the answer is maybe.
maybe.
Maybe. Okay. This is from a question from Clayton regarding menopause. Bioidentical hormone replacement pellets. Are they good for helping women over time and with aging? And is it better than creams for replacing hormones? I know this is quite controversial.
That's a bit of a loaded question because ACOG, which is the American College of OBGYN, has a stance on bioidentical hormones that are not endorsed, primarily because they are not approved by the FDA. So they have not gone through consistent manufacturing processes. They've not shown potency studies. They have not shown that they're any better than placebo. They've not done any of those studies at all. We can't say they're any safer. We can't say they're any more harmful. We just can't say that they're any safer. And so generally there are lots of other bioidentical hormones that are approved by the FDA, like micronized progestin and estradiol, that we feel are safer alternatives. There is a big industry out there, and some of those terms that are used are really marketing terms and not recognized by the FDA.
Yeah, there can be a high level of variability for any drug, not just bioidentical hormones, but any drug that is not kind of governed and standardized by the FDA. So, you know, there are very good compounding pharmacies out there that can make very good drugs, but, you know, as many good ones, there are probably some bad ones out there too. And without consistent manufacturing, like Dr. Collins was saying, it's hard to really have a standard for, you know, these compounding pharmacies and a consistent amount of hormone in any given dose.
But you understand, I mean, these women are, they're having a terrible time. They're kind of,
absolutely,
you know, desperate for a solution.
And I think that we understand that. And I think most of the time their gynecologist and the local physician can talk to them about the appropriate alternatives that we believe are better regulated and follow a different safety standard and have studies to prove how good they can be and their safety record.
Okay, this question from Wake Forest. What can I do for frequent bladder infections? About to have surgery, but have an infection now. I don't know what the surgery is for, but frequent bladder infections.
Generally, if someone is having frequent bladder infections that I have documented in my office with urine cultures, not just, I think you have a UTI, here's some medication, I generally will refer them to a urologist because they deserve a significant workup to make sure that there's nothing functional going on or another problem.
Okay, great. Now, coming up, a band of surgeons with a passion for women's health and music to support the cause. Coming up, we'll tell you a little bit more about that. This is Rex on Call. Welcome back to the show. This is Rex on Call. We're taking a final round of your questions. Let's get right to it. This is a question from Raleigh. She's 63 years old, has had normal pap smears, but her mother died of ovarian cancer. Should she continue having those pap smears after age 65?
So there's kind of two issues here. The normal pap smears, so she could probably safely stop with a pap smear screening. But pap smears don't screen, they just screen for cervical cancer. They don't screen for ovarian cancer. And so screening for ovarian cancer, people hear of the CA-125 lab level, but that's not a good screening test at all. It's not even elevated it's only elevated in about 80-85% of women who do have ovarian cancer. It's technically just a lab that measures the kind of level of irritation and inflammation in the lining of your abdominal cavity, but it's not good at all based on many studies for screening for ovarian cancer, unfortunately.
Okay. So this question saying, during menopause, is it common to bleed during intercourse?
It should not be common to bleed during intercourse. However, vaginal dryness is fairly significant in women and only talk to their physicians about 50% of the time. So it's not something women talk about, unlike hot flashes that everyone says. So if you have a moderate amount or severe amount of vaginal dryness, then there may be just some irritation from the tissues. And in that particular instance, there are over-the-counter products such as lubricants and moisturizers that you can do. There are estrogen products. There's a new pill product that's out right now for women who have painful intercourse due to vaginal dryness. So there are other alternatives, but a good pelvic exam should also be performed just to make sure there's nothing unusual going on.
And you're right, people talk about hot flashes, but that's not a topic. That's just
exactly
as common,
right.
and people aren't bringing it up. And now this question from Raleigh. In the morning, she has problems with bladder control, but she's not able to empty her bladder. So could this be caused by a kidney stone, she's wondering?
Generally, kidney stones are going to give you more pain, maybe some blood in your urine, not necessarily issues with emptying, and certainly not some of the other issues.
Right.
Clearly, I think that deserves an evaluation.
Okay, yeah. She's 72, she's from Pinehurst, and she feels like her bladder has dropped. What should she do?
It's not uncommon that it would be very similar to some other pelvic organ prolapse that we heard about at the very beginning. That can occur over time and with gravity, and a good physical examination should be able to give some insight into that and decide whether there are treatments such as physical therapy, such as pessaries, which are inserts in the vagina that help hold the bladder up, or surgical correction. So I think there are some alternatives.
And we've got that new pelvic health center at Rex.
Dr. Matthews would be great at taking
Yes,
a look.
absolutely. Yeah. Now, this question from Warren County: had her uterus removed but still has ovaries. Do you still need to get a pap smear?
If she's had a complete hysterectomy and she hasn't had a history of cervical dysplasia, she probably doesn't need pap smears. But when she follows up with her, gynecologist, they will be able to sort the details out.
Okay, now she's 50 years old, this caller. Is there a vaginal reconstructive surgery because she feels like her muscles have failed? She's hasn't had bladder control for a couple of years.
That can be a complex issue with a lot of different causes for that. Actually at the Rex Pelvic Health Center, they have a multidisciplinary approach to evaluate these things and determine what the cause or causes might be to best treat it.
And there's certainly different treatment options. And how long, again, a lot of questions on menopause, how long are those hot flashes going to last?
Again, they are variable from person to person. Generally, the further out you get from that last period, they will lessen over time. However, in the interim, you do some things like dressing in layers, decreasing the temperature, relaxation techniques. All of these things can sometimes help improve those hot flashes.
Okay, and really quickly, last question. We're talking about the hepatitis C testing with the baby boomers.
Very good information. The U.S. Preventative Services Task Force just came out with a recommendation that all people, not just women, but all people born between the ages of 1945 and 1965 should have a one-time hepatitis C test, because even though it's only 25% of the population, they make up 75% of hepatitis C.
Okay, and they got to get to that. Great information. Now, finally, there's a band of surgical oncologists that'll be lending their voices to the fight against women's cancers. The band is NED, which stands for No Evidence of Disease. Those, of course, are the words every cancer patient longs to hear. All band members are gynecologic oncologists from around the country, featuring UNC's Dr. John Boggess and Dr. John Soper. The goal is to bring awareness to gynecologic cancers, and you can attend their next show. Come to Rock for Hope. It's a music festival supporting cancer awareness. It's free this Saturday from noon to 5 at the North Carolina Museum of Art Museum Park Theater, and it'll be emceed by WRAL's very own meteorologist Elizabeth Gardner. So we really hope to see you there. And please join us next time for our next Rex on Call, which is October 21st at 1 o'clock. We are talking breast health. We're talking breast health, cancer prevention, and treatments. You can email us your questions ahead of time to rexoncall@rexhealth.com. Thank you so much, doctors, for coming to join us, and we will see you next time.
This has been a paid commercial program. Views expressed belong to its participants and are not necessarily those of the management and staff of WRAL or Capital Broadcasting Company.